Hi, SBA members. I'm going to just go over real quick with you before our meeting at 5 o'clock Central Time today. Here's a little instruction on how we should use the forms for patients that are actually being treated by chiropractors. Some of you in this site are actually doing treatment. So let me show you something. Okay, if you go to the SBA Facebook site, you will see in here the discussion, of course, is everybody sees that, but there's a place called files here as well. Now, this week I've been posting quite a number of files. I'm going to show you some that I want you to use all the time when you're treating. Let's go to the files. So anybody who gets a treatment by the chiropractor other than nasal cleaning and nasal airway opening, which is considered a hygiene practice and not an actual sleep apnea treatment. So you'll have to do these things. Now, if you're using an INET with your patients, they all have to sign this consent form, okay? This is the INET consent form. And that when you click on that, it'll download to your computer and you'll open it up, but take a look at it, okay? All right, the second thing is you want to make sure that they sign a consent form for treatment. So there's the AADSM consent form. Anybody who goes through any kind of treatment with you needs to sign the AADA consent form. Now, this particular form has a lot of dental references in it. You can leave those in and add to them, or you can take those out depending on what you're doing. If you get a prescription for an oral sleep appliance, then might as well leave it in there. But when they go to the dental office, when you refer them to the dental office, they're going to need to sign this anyway. But I think you need one for your records. So if they're using INAP, they need to have this one. If they're not using an INAP, they're using something else like a Bongo RX or some sort of oral appliance or some other treatment that we're doing with like Excite OSA, then they need to sign just this form. Now, if a patient comes in and they're getting any kind of treatment from you, here's an additional form that Dr. Zelk has recommended that you always have in your record. If you do any kind of treatment for sleep apnea, they must sign an affidavit for intolerance to a CPAP. And that form, intolerance, the CPAP intolerance form, is going to be signed whether they are using a CPAP or not. Did you understand that? No matter what treatment they're doing, and if they're not even using a CPAP, they must sign an affidavit for intolerance to a CPAP. Because CPAP is so commonly recommended as a standard of care, we must have that in our charts saying that the patient is signing this form, and this will protect you legally. Okay. The second thing we're going to talk about this evening when we get on the line for all of you is we're going to talk about many of you in the SDR program who want to start treatment. We're going to have some requirements for those who want to do treatment, and these got to be implemented. I talked to Sean about it yesterday, and these have to be put into place to protect you and to protect SBA. So I'll see you at 5 Central Time on the link. Shane, be sure and repost that link so that everybody has it. Thank you very much.